Open your mouth. Right now. Before you do anything else. Stick your tongue out and look at it. Really look. Most people see a chunk of pink muscle that helps them chew and talk. I see diagnoses. 15 years of clinical practice, and I have watched stomach cancer, advanced liver cirrhosis, and type 2 diabetes announce themselves on the tongue months before any blood test caught the problem. In 2021, a woman posted a picture of her tongue in an online medical forum. The surface was completely smooth, shiny like polished glass, without any of the tiny bumps a healthy tongue is supposed to have. The comments filled up with generic advice. Drink more water. Take some vitamins. It's just stress. One single comment was different. See a hematologist today. Not tomorrow. She went. Severe pernicious anemia. Her red blood cell count had dropped so low she was weeks away from heart failure. No obvious symptoms yet, no extreme weakness, no shortness of breath. Just a smooth tongue. That one detail saved her life. This is not a feel-good story. This is a clinical fact. And it raises a question you should be asking yourself right now. When was the last time you actually looked at your tongue? The medical system you rely on was not built to keep you healthy. It was built to treat you when you get sick. There is no billing code for prevention. Your next checkup will not include a tongue exam. Your doctor will not ask you to open your mouth unless you complain about a sore throat. My name is Dr. Grace Prescott. I have spent 15 years working in functional medicine and longevity, and one of the first things I learned is that the human body never stays quiet. It is always talking. The problem is most people do not know how to listen. Subscribe to this channel and hit like right now. We are building something real here, a community of people who refuse to wait until it is too late. Before we get into the specific signs, I need to destroy a myth that has been circulating for generations and is preventing you from reading the real warnings your tongue is sending. A white or coated tongue means your stomach is dirty and you need a cleanse. You have heard this. Someone looked at your tongue and said, "It is loaded, drink a detox tea, take a laxative, clean out your system." Not true. Completely, clinically, demonstrably false. Research published in the Journal of Oral Pathology and Medicine, one of the most respected peer-reviewed journals in oral pathology, definitively showed that the white coating on the tongue is not accumulated dirt from the stomach. It is an overgrowth of dead cells from the tongue surface mixed with bacteria, food debris, and in many cases, fungi. And the causes? Chronic dehydration, mouth breathing during sleep, prolonged antibiotic use, uncontrolled diabetes, and in more severe cases, oral candidiasis, a fungal infection that signals a severely compromised immune system. If you have spent years believing the cleanse myth, you have almost certainly ignored every other signal your tongue has been sending. And some of those signals are literally life and death. To understand why the tongue is such a powerful diagnostic tool, you need to understand what it actually is. The tongue is not just a muscle. It is an extremely vascularized map. Thousands of tiny blood vessels run just below the surface, so close that what is happening in your blood becomes visible to the naked eye. Color, texture, shape, moisture, all of it directly reflects the body's internal state. In traditional Chinese medicine, the tongue is called the mirror of the internal organs. And while modern Western medicine has discarded much of Chinese tradition, this part holds up. Modern studies confirm it. Changes in the tongue appear before systemic symptoms in dozens of conditions. Think of the tongue as a car's dashboard. When a warning light comes on, the engine is still running. The car still drives. But something is already wrong. If you ignore the light, eventually the engine will fail. The tongue works exactly like that. It warns you before the entire system collapses. The surface of the tongue is covered with tiny projections called papillae. There are 4 types, but the ones that matter most here are the filiform papillae, those small structures that give the tongue its slightly rough texture. When these papillae disappear, the tongue becomes smooth. When they overgrow, the tongue becomes hairy. When they inflame, the tongue turns bright red. Every change means something, and the body is not guessing. It is accurately recording what is happening inside. Now, let us read the dashboard. I am going to show you 7 categories of signs that most people ignore every single day. organized by color, texture, shape, and location, each one connected to specific conditions. Some frightening, all treatable if caught early. Hold your tongue out under a bright light. A healthy tongue is pink alive, with good color saturation. If yours is pale, almost white, washed out like it has been bleached, this is not genetics. This is anemia. Anemia means you do not have enough red blood cells circulating in your blood, or the cells you do have are not carrying enough oxygen. And because the tongue is one of the most vascularized tissues in the body, the drop in hemoglobin shows up there first. The most common causes: iron deficiency, vitamin B12 deficiency, folic acid deficiency, or chronic blood loss you did not even notice, like slow gastrointestinal bleeding caused by long-term use of anti-inflammatories. Here is a fact that surprises even doctors. In a study published in the American Journal of Medicine with 412 patients diagnosed with iron deficiency anemia, 89% had a pale tongue before any other classic anemia symptom appeared. 89%. The tongue gave the warning before the fatigue, before the shortness of breath, before the dizziness. Let me tell you about Margaret. 68 years old, retired teacher, lived in Vermont. She came to my office complaining about tiredness she attributed to aging. It's just age, doctor. I asked her to open her mouth. Completely pale tongue, almost no color. Blood test, ferritin at 8. Normal would be above 50. She had severe iron deficiency caused by microbleeding in the stomach from daily ibuprofen use for arthritis. 2 weeks of supervised iron supplementation, the tongue color came back. 3 months later, levels normalized. She told me, "I did not know it was possible to have this much energy again." If your tongue is pale, you need a complete blood count, not a generic checkup. A CBC with ferritin, B12, and folic acid. And if you use anti-inflammatories regularly, talk to your doctor about alternatives. The opposite of paleness. An intense red tongue, shiny, almost inflamed. This has a technical name, glossitis. And the causes are multiple, but all serious. First, severe vitamin deficiencies. Specifically B2, riboflavin, B3, niacin, B6, pyridoxine, B9, folic acid, and B12, cobalamin. When these vitamins drop, the tongue's mucosa becomes inflamed. The color turns bright red because blood vessels dilate. Second, infections. Scarlet fever, a bacterial infection that starts as a sore throat and produces a characteristic strawberry red tongue. Rare in adults, but not impossible. Third, and this is what worries me most in patients over 60, glossitis associated with undiagnosed celiac disease or inflammatory bowel disease. In these cases, the intestine does not absorb nutrients properly, B vitamins plummet, and the tongue screams in red. A study in the British Journal of Nutrition followed 230 adults with atrophic glossitis, that bright red, shiny tongue with papillae loss. 67% had undiagnosed celiac disease. 67%. And most had no obvious digestive symptoms. No chronic diarrhea, no severe abdominal pain. Just a red tongue they were ignoring. If your tongue is bright red and shiny, especially if the sides are smooth and the papillae are disappearing, you need a complete gastrointestinal workup. Tests for celiac disease, intestinal inflammatory markers, and AB vitamin panel. I am not talking about slight discoloration after drinking coffee. I am talking about genuine yellow, visible, that persists even after brushing. First cause, bacterial overgrowth on the tongue surface. This happens with chronic dehydration, mouth breathing, smoking, and prolonged antibiotic use. The papillae retain dead cells, bacteria overgrow, and bacterial pigments turn the tongue yellowish. But here is the dangerous part. A yellow tongue can also be jaundice, bilirubin accumulation in the blood. Bilirubin is the breakdown product of red blood cells processed by the liver. When the liver cannot process it adequately, or when there is excessive destruction of red blood cells, bilirubin accumulates, and the first thing that turns yellow, even before the skin and eyes, is the tongue. Causes: hepatitis, cirrhosis, bile duct obstruction, or hemolysis, accelerated destruction of red blood cells. If your tongue is yellow and you have also noticed that the whites of your eyes are slightly yellowed or that your urine is dark like strong tea, you do not wait. You go to the emergency room. Jaundice can progress rapidly. But if the yellow is isolated with no other symptoms and you have chronic dry mouth, breathe through your mouth during sleep, or just completed a cycle of antibiotics, the problem is simpler: inadequate oral hygiene and dehydration. The solution: daily tongue scraper. Increase water intake to at least 64 ounces per day, and consider a bedroom humidifier if you mouth breathe. Yes, this exists. And yes, it looks as scary as the name suggests. The condition is called black hairy tongue, and it is caused by overgrowth of the filiform papillae that accumulate pigments from bacteria and yeast. It looks like cancer. It is not. It is almost always benign, but it is a sign that something is severely dysregulated. The most common causes: excessive use of mouthwash with hydrogen peroxide or oxidizing compounds, heavy smoking, broad-spectrum antibiotics for weeks on end, radiation therapy to the head or neck, and recurrent oral candidiasis. A study in the Journal of the American Dental Association documented 58 cases of black hairy tongue. 91% of patients were smokers or had completed antibiotic treatment in the previous 4 weeks. 91%. The connection is direct. If you look at your tongue and see dark patches, almost black, with a hairy texture, first, stop panicking. Second, review your medications and habits. Third, see a dentist or doctor to rule out underlying fungal infection. The good news: this is treatable. Daily cleaning with a tongue scraper, discontinuation of aggressive rinses, and in fungal cases, topical antifungals for 10 to 14 days usually resolve it. Back to the story I opened the video with. Completely smooth tongue, no papillae, shiny like polished glass. This is called atrophic tongue or atrophic glossitis. The filiform papillae, those tiny projections that give the tongue texture, disappear completely. The result is a smooth surface, sometimes painful, sometimes just strangely shiny. Cause number 1: severe vitamin B12 deficiency. B12 is essential for rapid cell renewal, and the tongue has one of the fastest cell renewal rates in the body. When B12 drops, cells do not regenerate, papillae die, and the tongue becomes smooth. This happens in vegans who do not supplement B12, in people over 60 who have reduced stomach acid production, which is necessary to absorb B12, and in patients with pernicious anemia, an autoimmune condition where the body attacks the cells that produce intrinsic factor necessary for B12 absorption. A study in the New England Journal of Medicine followed 114 patients with pernicious anemia. 100% of them develop atrophic glossitis before developing severe neurological symptoms like peripheral neuropathy and dementia. 100%. The tongue warned first. If your tongue is smooth, you need a serum B12 test and ideally a methylmalonic acid test, which is more sensitive. If B12 is low, you need supplementation, often injectable, because the problem is usually absorption, not intake. Look at your tongue surface. Do you see small fissures, cracks, deep grooves, especially in the center or on the sides? This is called fissured tongue or scrotal tongue. In most cases, it is a benign anatomical variation. About 5% of the population has fissured tongue from birth, and it means nothing. But when the fissures appear suddenly, or when they become deep and painful, everything changes. Sudden fissures can indicate severe chronic dehydration, zinc deficiency, Sjogren's syndrome, an autoimmune disease that attacks salivary and lacrimal glands, leaving mouth and eyes extremely dry, or allergic reaction to acidic foods. Sjogren's syndrome is especially important to rule out. It mainly affects women over 40 and often goes undiagnosed for years. The symptoms: extreme dry mouth, dry eyes, fatigue, joint pain. And the tongue develops deep fissures because the lack of saliva prevents adequate surface hydration. If your fissures are new, if your mouth is chronically dry, and if you wake up with a gritty feeling in your eyes, you need antibody testing for Sjogren's, SSA and SSB tests, and an ophthalmological evaluation with Schirmer test for tear production. Stick your tongue out and look at the sides. Do you see impressions of your teeth, as if the tongue had been pressed against them? Small ripples, scalloped marks on the edges? This is called scalloped tongue or crenate tongue. And it means one of two things. Either the tongue is too swollen for the mouth space, or you are unconsciously clenching your teeth during sleep. First cause, fluid retention. Hypothyroidism, heart failure, or kidney failure make the body retain water, and the tongue, being a highly permeable muscle, swells. When you close your mouth, it presses against the teeth, leaving marks. A study in the Journal of Clinical Endocrinology and Metabolism examined 89 patients with undiagnosed hypothyroidism. 73% had scalloped tongue. When thyroid hormone levels were corrected, tongue swelling decreased in 6 to 8 weeks. Second cause, deficiency of certain vitamins, especially B2 and B3, which cause inflammation of the oral mucosa, making the tongue swell. Third cause, and this is behavioral, bruxism, grinding or clenching teeth during sleep due to stress, anxiety, or sleep apnea. In these cases, the tongue may be normal size, but constant pressure leaves the marks. If you have scalloped tongue, check thyroid first. TSH, free T3, free T4. If thyroid is normal, consider a sleep study to rule out apnea. And if you wake up with jaw pain or morning headaches, you are probably grinding your teeth and need an occlusal guard. Before we continue, let me ask you a question. How old are you? Write your age in the comments right now. I want to know who is watching this channel. Knowing the age distribution of this audience helps me choose which topics matter most for the next videos. So write it 55, 62, 71, 80? I want to see everyone. And if this video is helping you, if you have already looked at your tongue and recognized any of these signs, hit like right now. That helps the algorithm show this content to more people who need it. Now let us move to the final signs. And these are about location. Where on the tongue the problem appears matters as much as the problem itself. White patches on the tongue that you cannot remove by scraping. This is called leukoplakia. And while most cases are benign, leukoplakia is considered a premalignant lesion. Most common cause, chronic irritation. Smoking, chewing tobacco, friction against a broken tooth, or poorly fitted denture. But here is the danger. In 3 to 17% of cases, depending on the study, leukoplakia evolves into squamous cell carcinoma, oral cancer, within 5 to 10 years. If you see a white patch that will not come off, especially on the sides or underneath the tongue, and especially if you smoke or used to smoke, you go to the dentist or an oral surgeon for a biopsy. Not, I will watch it for a few months. Now, an ulcer on the tongue, on the side, painful, that persists for more than 14 days without improvement, is cancer until proven otherwise. Common canker sores heal in 7 to 10 days. If it has been over 2 weeks and the lesion is still there, or worse, it is growing, this needs immediate biopsy. Squamous cell carcinoma of the tongue is one of the most aggressive oral cancers, but if caught early, the 5-year survival rate is above 80%. If caught late, when it has already metastasized to the neck lymph nodes, it drops to less than 40%. Time matters. And your tongue is giving you time. We have covered a lot. I understand this may feel like too much to hold at once. So here is a practical system. 6 steps, 3 minutes a week. This is what I want you to walk away doing. Examine under natural light. Daylight is ideal. Household bulbs distort colors. You can miss yellowish or grayish tones completely. Check color. Pink and uniform? Normal. Pale? Possible anemia. Bright red? Deficiencies or inflammation. Yellow? Dehydration or jaundice. Dark patches? Rule out fungal infection. Check texture. Run your finger lightly over it. Slightly rough? Normal. Smooth as glass? B12 deficiency. Deeply cracked? Dehydration or autoimmune. Check the sides. Teeth marks? Swelling or bruxism. Persistent white patches? Leukoplakia, needs biopsy. Check under the tongue. Lift your tongue. Look at the veins underneath. They should be thin and bluish. If they are dilated, tortuous, or prominent, this can indicate circulatory or liver problems. Photograph monthly. Use your phone. Take a clear picture of your tongue with flash. Date the photo. In 6 months, you have a visual timeline to show a doctor. Treat this with the same seriousness you treat checking your blood pressure. Your tongue knows as much about your health as a blood pressure monitor. Your body gave you a free diagnostic instrument that runs continuously, needs no batteries, needs no subscription, and needs no appointment. It is running right now inside your mouth. Use it. If this video helped you, send it to someone you care about. A parent, a friend, someone who might be ignoring a sign right now that they did not know meant anything. You may have just given them a real chance to catch something early. What you just heard is not what you will get at a standard doctor's visit. There is no financial incentive for a system to keep you out of the waiting room. But we are building something different here. Help Dr. Grace Prescott grow. Subscribe. Hit like. We are building a community of people who refuse to wait until it is too late. And we need you here. The responsibility for your health is yours, not the system's. Yours.